Over the last 24 hours, we have identified 916 new cases of COVID-19 and completed about 12,700 tests. Our positivity rate was about 7.5%. There are currently active alerts or outbreaks in 342 schools. Of these, 8 schools are on outbreak. There are currently 1,016 people being treated for COVID-19 in hospital, including 231 in the ICU. Sadly, 30 new deaths were reported to Alberta Health over the last 24 hours. While these deaths occurred over multiple days from October 7th to October 13th, this is another tragically high total. As we have seen before, most of these deaths involve those who are not fully vaccinated. I want to assure Albertans that the vaccines remain highly effective. They offer great protection against the Delta variant and are the best way to help protect our most vulnerable. The high number of fatalities that we have seen recently are the result of rapid spread that occurred in this fourth wave. This is another reason why we all need to keep limiting in-person contact and driving cases downward. All of these people's lives mattered, and they will all be missed. I first want to apologize to the family of the 14-year-old whose death I spoke about on Tuesday. The pain of losing a child is terrible enough without having that loss compounded by a public debate about the circumstances. I am sorry if the way that I spoke about that death made your grief worse. Since the start of this pandemic, I have heard from many Albertans, including those who have lost a loved one. I reflect often on the impact that our reporting, measures, and every other element of the pandemic response has on them. When I speak about cases and our reporting process, it is not to diminish the losses, whether caused by COVID or anything else. At the same time, we are in a global pandemic. We have an obligation to monitor and report deaths from COVID-19 infection and to be as timely and transparent as possible. In our reporting, we always include all deaths that have COVID as either a primary or secondary cause of death, according to the healthcare teams that were involved in the cases. For example, a primary cause would be someone in whom COVID infection progresses to pneumonia, and this is the direct cause of death. A secondary cause could be a case where someone with a severe underlying illness, such as heart failure, gets COVID, and the infection makes their pre-existing condition worse, leading to death. We report in this way to accurately capture the impact that COVID-19 is having. That is also why our reporting process includes both deaths that come to us where a person has COVID listed as a primary or secondary cause of death, as well as cases with a recent diagnosis of COVID where the cause of death is still under investigation. To make sure we are as accurate as possible, after a death is reported, if there is uncertainty, it is reviewed to validate our information. If that review identifies that COVID was not a primary or secondary cause of death, it is removed from our totals. Every surveillance system has to balance this tug-of-war between precision and timeliness. The more precise reporting is, the slower it is. We have chosen to focus on being as timely as possible in the interests of transparency. Sometimes, though, as in the case reported on Tuesday, the initial information provided to us changes after a review. While the initial report of the death of the 14-year-old included COVID as a secondary cause, we have now received additional information that indicates COVID was not a cause of death.
This morning, our ICUs were at 76% occupancy, and we had 97 ICU spaces throughout the province available for new patients who require critical care. This is a significant improvement from just 1 month ago, when our ICUs were close to 90% occupancy, including the surge capacity, and the number of ICU patients was increasing rapidly each day. The number of COVID ICU patients being admitted every day across the province has reduced from more than 20 per day about a month ago to now about 13 to 15 per day. This is still a high number because these admissions are preventable. As I said on Tuesday, I'm cautiously optimistic. Our occupancy without the surge capacity of 203 beds is at 163%. This is better than the 172% I announced on Tuesday and 184% back on September 28th. And after experiencing perhaps the most difficult period in our healthcare system, we welcome good news. The number of exemptions that we've had so far is about 750 or so, and about half of them are based on medical exemption requests, and the other half is based on religious exemptions, and there's a very small number that is a combination of both. They are being reviewed through a special committee that we've pulled together with expertise to actually look at each of them individually. They do have to submit information in order for us to be able to review them, and that process is going to be done over the next few weeks. So it's not that they have to be completed by this Saturday. What I need completed by this Saturday is the information about the vaccination status.